times get hard, and we're here to help at NorthPoint.
Hello listeners, thank you for joining us on NorthPoint's Making Help Happen. Today we are going to be talking about anxiety and depression with our very own Dr. Meagan Abel. Dr. Abel is a clinical psychologist with specialty in assessment and treatment of trauma, depression, anxiety, and the management of chronic health conditions. She provides individual therapy to children and adults at NorthPoint and facilitates many group programs at the clinic, including DBT groups, a queer identity support group, chronic pain support group, and program for Hmong and Laotian women. Dr. Meagan has been a strong advocate, particularly with regards to issues of race and gender. She is known for her down-to-earth, holistic approach and draws from evidence-based practices and methodologies to help people make meaningful change in their lives. Welcome, Dr. Meagan.
Thank you.
We're so excited to have you here.
Yeah, I'm excited.
You're busy.
Yes.
You are busy. Well, thank you for making time for us.
Of course.
So I'm going to start out by asking you what reason, why did you choose to go into this particular field?
You know, I first took a psychology class when I was in college. It was a health psychology class, and really that taught me how about the mind and body connection, and that really got me interested in psychology. And so from there, I just gravitated towards it and really went all in.
All right, wonderful. And you've been with NorthPoint for how long?
Ooh, I have been with NorthPoint since 2012, so quite a long time. Yeah,
So
in many different roles.
Okay, so you have really just been grounded here and grounded in the community.
Yeah, absolutely.
Wonderful. So we are very busy people, and you know, with our busy lives, as adults, as young people, we get a lot of stress.
Yeah.
Right? Yeah, stress is normal. There's a lot of normalcy around stress, but how does someone recognize the signs of anxiety and depression in order for them to seek help?
You know, I think first of all, you're right. Stress is absolutely normal. What's most important is understanding the symptoms of depression and anxiety. So with depression, most people experience low mood. You feel sad all the time. You might feel tired, hard to focus, hard to concentrate. You might feel kind of sluggish, like you're dragging yourself through the day. Some people feel restless, like it's hard to sit still. And some people have thoughts of wanting to hurt themselves. If you get to the point where you're feeling like that, it's okay at any point to come in and talk to a therapist.
Okay.
Most people start to see that they're kind of pulling away from their usual activities. It might be hard to get up and get ready for the day. You might miss work or social activities. You might not go to that community event. And you're just kind of feeling not like yourself. With anxiety, we often see people feel worried a lot about a variety of things. It might feel hard to control worrying. You might feel panic or kind of stress in your body. We might feel restless, pain, muscle tension, all that stuff. So if you're feeling that way at all, it's always okay to come and talk to somebody.
Sure, because your mental health is just as important as your physical health. Right?
Yeah, and I think most people don't realize you can go and talk to a therapist even when things are not severe. And so that's actually a great time to go. You can figure out more things about yourself, about your life. But then, of course, if you're experiencing those symptoms and it's really impacting you, we want you to come in and talk to us.
Sure. Right now we're talking about people getting help for themselves, right? Recognizing those signs and actually taking that next step to seek the help that they need.
Yep.
But we know that there are internalized barriers and often some intergenerational messages that prevent us from doing that in our culture. Can you talk about that a little bit?
Yeah, so I think, mental health tends to be stigmatized. And what that means is that there are a lot of negative beliefs about people who experience mental health symptoms. So it's really important, one, to recognize most people are not having conversations about mental health at home with their families. And that is definitely intergenerational. And so you don't learn that talking about mental health is actually a normal thing and we all should be doing it. The other thing with those beliefs, right, about mental health, people believe different things about people with mental health symptoms like they're lazy, they're not trying hard enough, they just need to snap out of it, that kind of thing. And those are things that have been fed to us over the course of time that really make people not want to seek help because they think something's wrong with me, right? When what we know is mental health is actually a mind-body thing that's going on with people, and that it's okay to talk about it. Actually, talking about it is how we get through it, and learning some of those skills to help us manage those symptoms. Those things are also not taught in school, and so a lot of times people become adults and we just don't know how to manage those things on our own.
Sure. So you have someone that comes in, they finally come in, and they receive a diagnosis, and then there's this fear of being labeled, right? Like,
Absolutely.
okay, now I know I have this condition.
Yep.
What do you do with that? What do they do with that?
So I think getting a diagnosis can be pretty powerful because it can help us understand what's going on and the right treatment for that condition. And society is what comes in and kind of puts that negative label onto those diagnoses. So we have to learn how to separate from that and realize at the end of the day, we're just working on treating our symptoms. And that's what's important.
Okay, good. Now, when I introduced you to our listeners, you were trained in DBT.
Yeah.
And that's something that I think awareness about DBT has really come about in the last, 5-10 years?
Absolutely.
Can you talk a little bit about DBT, what it is?
Yeah, so DBT, it stands for dialectical behavioral therapy, and it fits really well with the therapy that I do. Essentially, DBT is a series of coping skills, and it's broken down into 4 different kind of categories, I would say. They're called modules in DBT, but let's call them categories for the sake of this conversation. And really, the 4 are relationships and self-esteem. So working on communication, saying no, being able to ask for what you need, distress tolerance, and that's about coping with emotions and learning how to kind of ride the wave of intense emotions at times. Emotion regulation, that's about keeping us steady and even keel, and even when stress is going on. The assumption there is that stress makes us more vulnerable to symptoms of mental health, things like depression and anxiety. And then the last one is about mindfulness. And that's kind of what taps into why I got into this field in the first place, which is just being present in the moment, not judging ourselves, living our best life, and really tuning into our bodies and what we're needing.
Wow. Very interesting. And let's talk about, because I know you work with a lot of young people, and I think DBT is one of those conditions. Am I saying that correctly? Conditions? I don't want to say disorder.
It's a treatment.
It's a treatment.
Yeah.
Yes.
Yeah.
Okay. That often, our young people are given those resources. Can you talk a little bit about your work with young people and what you see?
Yeah. I think it's really important to recognize that, NAMI, the National Alliance on Mental Illness, has reported that 1 in 5 adults will struggle with a mental health disorder. 1 in 6 kids or youth will struggle with a mental health disorder. And those numbers are higher in communities of color and the queer community. And so it's important to recognize that a lot of people do experience the mental health challenges and those symptoms. And with youth, we want them to come in and talk to us about what's going on, and then provide some education on what we're seeing, what the symptoms are, what a diagnosis might be, and then also to learn coping skills. And DBT is a series of coping skills to help people navigate through those things.
Okay. So I want to talk a little bit about, you said that we see this prevalent in our communities of color and in queer communities. Is that because of socioeconomic factors, or?
It can be.
Okay.
I think that a lot of times people from queer and BIPOC communities don't access services as much because of those barriers and the stigmas associated with that. And we're not talking about it in our households, right? And so we need to start having more conversations so people feel comfortable with asking for the support that they need and seeking out a therapist. We also don't have a lot of therapists of color or those who identify as queer. And so it's also really helpful to have a therapist who looks like you and can relate in that sense. People can feel more comfortable, not all the time, but that's one of the wonderful things we have here at NorthPoint. We have so many therapists of color and who identify from a community other than straight. Yeah.
Wonderful. So you answered my question. I was going to ask you that next. So we provide a safe space here at NorthPoint where our guests and patients can talk to someone about what they're experiencing, what they're feeling. Talk a little bit more about how important it is to have a provider who can interpret and address those unspoken dynamics as it relates to emotional and mental health.
I think it's really important. Oftentimes when people are seeking out therapy for the first time, we want you to have a good experience. It's important to recognize that we all, by that I mean therapists, have different styles, different ways of doing therapy. There are many dynamics that can impact that relationship, but just walking into a room, we can often feel a little more comfortable if we see somebody who looks like us and can relate in that way. So just thinking about that, going to a lunch table or things like that, being on a bus, when we see people who represent who we are, we tend to just be more open to having a conversation, and being ourselves and showing up in a way that feels genuine.
Sure, it's authenticity.
So it can build some trust. Yeah.
Yeah, so important. All right. So how can a guest listening today access mental health resources?
A guest can call our clinic and schedule an appointment with a behavioral health provider. We would love to have you come in and talk with us. Think of therapy as a conversation and a way to learn something about yourself. If you're really struggling, you deserve to get the help that you need and the support. And no one's going to make you do anything. I think a lot of times people can think, I'm going to go in for therapy and they're going to make me take medication. And that's just not the case. When you come in for therapy, we partner with you. We work with you to develop a plan that helps alleviate some of those stress and the symptoms you're experiencing. And sometimes that can happen within a few appointments. Sometimes that can happen over a course of time. There's no prescription, if you want to say. So
nice.
Just trying it out.
Right. Just having a conversation. I think that's a great way to think about it.
Yeah.
We have support groups here at NorthPoint. Can you talk a little bit about those groups?
Yeah, so we have a variety of groups. I lead a variety of groups at NorthPoint. I love group therapy. The reason for that is because everybody can come in and learn from each other. And then I, as the therapist, can provide some teachings on skills or different topics of the day. But I think it's a great way to connect with people and grow together. So I facilitate DBT groups at the clinic for all genders. We have a women's group and we have an all genders group. And then I also facilitate a chronic pain group, and that is for people, anyone experiencing chronic pain, to come together and learn from each other, learn about resources, and we talk about how thoughts and emotions impact pain and how to overcome that. And then I also run a program for Hmong and Laotian women, and then a queer identities group. And this is for anybody who identifies as queer to come together and to talk about the things impacting their daily lives. And so those are just the ones that I'm part of, but we also have a lot of other things. We have a domestic violence program for men and women, and then we also have a child and adolescent support group as well. And so that's a great way for young people to connect and to gain some coping skills as well.
Yeah, wonderful. I'm curious about the support group that you have for Hmong and Laotian women. Can you tell us a little bit more about that?
Yeah, so that group is such a joy to my week, but we come together and we talk about things going on in the community, things that have happened in the past, and the relationships, how to just bring joy into our life and take care of ourselves. And so that's kind of the topics that we cover.
So we've talked about formal support. What about informal support? If you're experiencing anxiety and depression, what are some informal ways?
To get some help? Absolutely. So first of all, I would say start to get educated and knowledgeable about different mental health conditions. You can do that through community events, through podcasts, through what you find on the internet, but just be cautious with that because not everything is true or accurate. NAMI is a great resource, I think, that has a lot of things for people to learn about mental health conditions. And then also, connect with your spiritual leaders, connect with other people in your family who may be going through something. Most people know somebody who has experienced depression or anxiety. We all do in certain capacities. And so we can connect with each other. Yeah.
Right. That's wonderful. Very practical advice. Yeah, you're down to earth.
Yeah.
Advice. That's great.
Yeah.
Is there anything else that you would want to share with our listeners today?
I think it's important if you're curious about therapy, if you're going through anything, if it's stress, anxiety, depression, always come in and talk to us. We're here to help. The other thing I want to say is, mental health goes hand in hand with physical health. If we're taking care of our bodies, we also should be taking care of our minds, and going to therapy and doing any group we have here, if that's something that would be helpful to you, helps you take care of your overall health so that, we are NorthPoint Health and Wellness, right? So your wellness is just at its optimal state. And so that's another reason why to seek support for mental health. It's just another form of healthcare.
Great. Thank you so much, Dr. Meagan, for partnering to create a healthier community. We appreciate you being on the program today.
Absolutely.
All right. Thank you for listening to this week's Making Health Happen. We want you to know that we're here to partner with you and to help make health happen in your life. To learn more about NorthPoint, call us at 612-543-2500 or visit us on the web at northpointhealth.org.